This program is called Finding Happiness During the COVID-19 Pandemic. The learning objectives are we will review how happiness is defined and measured, the benefits of happiness, the effects of COVID-19 on our mental health and happiness, and then 8 ways to improve happiness during this COVID-19 pandemic. Happiness is an ancient concept. Long ago, they talked about happiness. Even in the Bible, they said that a merry heart doeth good like medicine. So the idea of being happy is not new. How do we define happiness? Well, happiness can be defined as a feeling of subjective well-being associated with mostly positive moods and life satisfaction. And when we look at the research, they really measure happiness in 2 ways. One with a single item scale, pretty simple, and the other with a short multiple item scale. An example of a single item scale would be this delighted terrible scale, where the person just rates themselves somewhere between terrible and delighted. A more sophisticated scale is the satisfaction with life scale, where there are 5 statements. For example, in most ways, my life is close to ideal. And then the person rates the answer on a score of 1 to 7. And then they add up the numbers, and that gives you your satisfaction with life scale, which is a good indicator of your happiness level. Now, the question is, are there benefits to being happy? Well, an interesting study was done years ago in a convent where the Mother Superior, the boss of the convent, asked the young nuns coming into the convent around the age of 22 to write a short autobiography about themselves. And what they did later on is when the nuns unfortunately started to die, they looked at the autobiographies that were written years earlier, and they found that those autobiographies that were full of negative emotion and pretty depressing were associated with the nuns dying earlier. Their mortality rate was 2.5 times greater than the nuns who were happy and expressing satisfaction with life. So the idea is, and the theory is, that if you have a positive emotion early in life, you live longer. And so the question is, why would happy people live longer and be healthier? Well, happy people tend to have happier, healthier lifestyles. They also have more friends, richer social networks, and we'll talk about that later when it comes to COVID-19 and isolation. Also, if you're a happy person, they found that you had more production of those ingredients in your body that fight infections. For example, more T lymphocytes, more interleukin-6. Also, happy people were found to have more heart rate variability and less clotting factors, which led to less cardiovascular disease. And also, they found that happy people generally had less stress hormones, including cortisol and catecholamines like adrenaline. The question is, and I found this interesting, is the world becoming a happier place? And unfortunately, when you look at the World Happiness Report this year, they looked at data from last year, and they found that over the last 10 years, up until the end of 2019, levels of worry and sadness have gone up by about 1% every year. So the world is not getting, it is not becoming a happier place. And then, of course, this year, we have COVID-19, and that begs the question, will that have a further worsening effect on our levels of happiness? And of course, not surprisingly, since the pandemic started, there have been many studies looking at the mental health effects of COVID-19, and the news is not good. When they looked at adults, kids, teenagers, the elderly, patients with COVID, and frontline health workers, they found right across the board levels of depression and anxiety are going through the roof. It's not a good picture. People are becoming very unhappy and very stressed out by this pandemic. Now, unfortunately, I think the worst may occur next year when we see the economic fallout. So far, the governments in the developed countries have been generous and have supported people who've lost their jobs. But this can't go on forever, we don't think. And we believe that economic fallout is on its way. And so we've got to ask ourselves, is there a relationship between money and happiness? And the fact is that in very poor nations where poverty threatens life itself, money strongly predicts well-being. So if you've no running water, no clean water, no roof over your head, no shoes, your happiness level is going to be pretty miserable. It's going to be low. And in wealthier nations, such as Canada, the United States, increased personal wealth still increases happiness, but the effect is much, much less dramatic than it is in poorer nations. It's interesting also that household income explains less than 2% of the variance of happiness in any country. Mental health, on the other hand, explains much more of the variance of the happiness in Western countries than income does. So money, not so effective on happiness. And it's interesting, if you look at this graph from the United States, looking at GDP per capita, you can see GDP per capita has gone up steadily since 1972 to 2002. But if you look at the happiness line, you can see the happiness level has been slowly and gently decreasing. So we've got more money, but we're becoming less happy. It's interesting that a study was done in around 2008 in the United States, and they found that at around a household income of $75,000, the happiness level didn't continue to increase. So as you can see in this graph, the happiness level goes up and up and up and up until around 75,000 household income, and then it starts to flatten off. By the way, today, if you take $75,000 income, that's equivalent to around 90,000. So today in Canada, you'd expect the happiness level not to go up after you have a household income of 90,000. But for many people in Canada, as you know, that household income is not reached. So we have a problem, I think, and it's going to get worse next year with the economic fallout. If you look at this graph, you can see that life evaluation tends to go up and up and up, even beyond the household income of 75,000. And that is because if you go out in the morning and you have a Bentley in your driveway, or a Ferrari, or some fancy car that you love, and if you have a villa in the south of France or Tuscany, and if you travel around on your holidays in a private jet, well, your evaluation of your life is going to be much higher, clearly. You're going to think you're doing great, but that does not necessarily mean you're happier. So there's a little bit of a difference between this subjective feeling of well-being and life satisfaction. It's interesting, in Ireland, after the recession started in 2005, the unemployment started to rise, going up from 4% to 14% at the end of 2011. And during this time, the happiness level, when it was studied, went down, down, down. So happiness is related to unemployment. It's related to income, being able to afford the things you need to afford, like food, shelter, rent, etc. Now, when we look at happiness, the happiness level in all of us equals S plus C plus V. S is the set range. We're born with a certain amount of, if you like, cerebral joy juice, a certain amount of happiness that is sort of set there. And we can't do much about that. Studies have shown among twins that when your happiness level is such and such, you really can't increase the happiness in that respect, and your genetic makeup is sort of set. But what about C and V? Well, C are the circumstances of your life, 10% affecting your happiness, and V stands for the voluntary variable, 40%. So we can't change our genetics, that's 50% of happiness. We can't really change the circumstances, which is 10%. So for example, COVID-19, 10%, although it's a pretty serious circumstance. But we can, it seems, change our voluntary variable. Now, what are the voluntary variables? We'll come to that in one moment. But I just wanted to talk to you about how the happiness levels tend to be sort of fixed for most of us. So if we imagine ourselves with a happiness thermostat and something very good happens, such as winning the lottery, loads of money, we find that our happiness level goes up. But within around 6 months or so, the happiness level is pretty back to where it was before we won the money. And similarly, if something terrible happens to us, for example, we're in a car crash, or we're in a war situation where we become paraplegic, our happiness level clearly goes down. But what's interesting in this study was that even in these paraplegic situations, which were very serious and very worrisome, the happiness level was almost back to normal in around 6 months. So our happiness level tends to be pretty set genetically. And as I said, the set point of subjective well-being or happiness was back to baseline after winning the lottery, and almost back to baseline after a paraplegic incident within 6 months. But let's look at this voluntary variable, because in psychiatry and in medicine, that is the area that I and my colleagues focus upon, the voluntary variable. The voluntary variables are the steps that we can take as human beings to make ourselves happier. And when I look at happiness as it relates to the COVID-19 pandemic, I think there are 8 things that we can do and examine that can result in us feeling happier, even though this is a terrible time for us in our society. And those 8 steps are, in no set order, although I would put nurture relationships at number 1, but these steps are nurturing relationships, expressing thanks and savoring moments, practicing kindness to yourself and others, learning to relax and avoid news addiction, learning to forgive or let go, avoiding irrational or unreasonable thinking, looking after your body, and lastly, differentiating unhappiness from clinical disorders that need medical treatment, for example, depression, anxiety, insomnia, and things like that. So let's do a little bit of a deeper dive into each of these items. So number 1, nurture relationships. And as I alluded to earlier, one of the commonest complaints expressed during the COVID-19 pandemic is loneliness. And this has been associated with quarantine and lockdowns, and the studies have shown that quarantine and lockdowns are associated with increasing depression, anxiety, boredom, irritability and anger, and loneliness. And the studies have also shown that we can reduce the effects of quarantine, isolation, and lockdown by activating our social networks, getting more involved with friends and family. We can also reduce the impact of quarantine by having crisis lines. So crisis lines or hotlines or helplines 24/7, where people can phone in and express their stress and disappointment and frustration, can be very helpful in relieving the impact of loneliness. And of course, online counseling is important. It's very hard sometimes to find a counselor, especially during these times of COVID, and having online counseling available can be very helpful. So these are some of the ways that we can reduce the impact. Now, there are some potential benefits of quarantine. I've had some people, some of my patients tell me, it's great working at home. I don't have to drive and negotiate traffic. I don't have to pay for parking. Fabulous, I love it. Others, younger patients of mine, students, especially those with social anxiety and who find it difficult out and about with other adolescents, have said that they find it easier at home, easier to be at home, to study at home, because they don't have to deal with their social anxieties. And another example of an advantageous situation when it comes to quarantine is young lovers and old lovers, because making love and having new relationships can always lead to you wanting more and more time. So there are some advantages of quarantine. Now, one of the serious issues with regard to quarantine, isolation, and loneliness is the situation with elderly folk. The quarantine and lockdowns have resulted in social isolation, loneliness, and depression. So it's very important that we are aware of the impact of COVID-19 on the psychological well-being of the elderly. Also, the physical impacts of COVID-19 are much more serious on the elderly, because it's really in the older people that the results of the COVID-19 infection are much more serious, with a higher morbidity and mortality rate. So that's led to us sort of isolating the elderly at home. So it's very important that we pay attention to these folk. Loneliness and depression are very related, and as you can see on this graph, the probability of depression increases in those lonely people. On the right-hand side of the graph, you can see the lonely people have a higher depression level, and when they had a larger social network, the lonely people had lesser depression, but still more than the people who didn't feel lonely. So it's important that we approach loneliness seriously. Now, there are ways, thank goodness, of nurturing relationships during lockdown, and a lot of those ways are related to apps. Apps are computer programs that allow folk to communicate face-to-face, and this can be a lifesaver. Skype, Zoom, FaceTime can bring people together, and not only through voice, but also through seeing the faces of those you're talking to. And that can be very, very relieving of isolation feelings and depression. The problem, of course, is that the elderly may not be tech savvy and may find it difficult to use these apps. So time has to be taken teaching them and hopefully helping them learn how to communicate in this way. Marriage, they found in a 17-nation study, does improve happiness by giving financial support to the couple, emotional support, and overall better physical health. And when they looked at this study, they found that married people were happier on average than single people, and cohabitating people were less happy than married people. So marriage seems to be protective, and that leads to you being able to share your joys and have your disappointments. So marriage can be very helpful. But the question remains is, does marriage make you happy, or do happy people marry? And that answer hasn't been found consistently through the literature. But marriage does seem to make you feel better and happier. Pets are also important. It's interesting. Pet owners were happier, less lonely, less depressed. And in this study, they found that the support from a pet was equal to the support from parents or siblings. The only person or people who beat pets when it came to the effect on happiness was a best friend. Volunteering is very important, especially in those folk who have retired. So we're thinking of elderly patients again, and they find volunteering very helpful. Volunteering at the school, at the church, at the senior center. This can lead to improvements in many aspects of well-being. The problem is that COVID-19 canceled these activities, and this was very impactful too. Also, when it came to religious activities, religious involvement leads to a lot of social support, and that can result in better health. But as you know, these activities were also canceled during COVID-19, leading to a further negative impact on mood and anxiety levels in all people, but especially those who enjoyed going to church, who enjoyed volunteering. So enough about relationships. What about thanking, being thankful, expressing gratitude? Well, gratitude means being thankful and recognizing that we could not be who we are or where we are in life without the contributions of others. Recognizing that does make us feel better. For example, at our hospital where I work, I remember coming out from work one day and there were placards everywhere. I think there must have been dozens of them all along the walkway up to the car park where the doctors and nurses and social workers, where all the frontline health workers were parked. And it meant so much to us. I remember thinking to myself, that is so cool. So this was a way of the hospital administration expressing thanks to the workers at our hospital, and it was very much appreciated by us, the frontline workers. There was an interesting study done when it came to gratitude. For 2 weeks, students were asked to record either 5 things they were thankful for or 5 things that bothered them. And at the end of the study, they found that the students who were thankful were much more positive in their mood. They rated their life more favorably, were more supportive to others. They had better sleep. They were less physically ill. So being thankful is very important, and it does improve our happiness level. There are benefits of thanks, which include better friendships, showing respect for others. It reduces envy and bitterness. It facilitates forgiveness. It reduces stress overall. So being thankful is very positive. It's interesting, when it comes to being thankful, the idea of savoring the moment fits into this area because we rarely cherish and enjoy present moments. For example, among my patients, my depressed patients are always worried about the past, things they did in the past. They're full of guilt, they're full of regret. Why did I do that? Why did I do this? It's important that we don't concentrate on the negative past. And similarly, patients with anxiety disorders are always worried about the future. What's going to happen tomorrow? What will be this? What will be that? It's important that we try to take a breath and live in the moment, not postpone our happiness until tomorrow. Try and live more in the now and notice the simple, beautiful things in life. So we can be in the midst of a pandemic, as we are, and yet still notice and appreciate the wonderful things that still go on around us day to day. So nurture relationships, be thankful. The third step to happiness during the COVID-19 pandemic is practicing kindness. An interesting quote from the Dalai Lama was, the more we care for the happiness of others, the greater is our own sense of well-being. And another study looking at students asked the students to perform 5 acts of kindness weekly for 6 weeks. And interestingly, at the end of the study, they found that the students who were performing acts of kindness, for example, donating blood, visiting an elderly relative, writing a thank you note, those students were much happier than those who did not perform acts of kindness. Number 4, learning to relax and avoid news addiction. This is so important right now. And just before I talk about the impact of news addiction and stress, I just thought I'd define stress, because we sometimes don't realize what stress actually is. Stress is the physical and psychological response to an activating event or stressor, which is considered to be threatening or challenging. So obviously, COVID-19, the disease, the uncertainties, is very threatening and very challenging. And that's why we've had these physical and psychological reactions to this event. News addiction can be very, very off-putting. It's 24/7, and it's almost hysterical, whether it's Fox or CNN or Canadian outlets. It's a lot of negativity. And one of the papers stated that the information overload had converted COVID-19 into a digital infodemic, suggesting that it wasn't only a pandemic, but that this negative news barrage was very damaging also. A way of relaxing is to meditate, to learn how to do breathing techniques. I have an interesting program on YouTube which will help you do that. Just type "Creating Inner Calm" with Mark Berber, MD, into the search bar, and you'll have several relaxation choices: breathing, muscle relaxation, relaxing on the beach. These may help you avoid this stress due to news addiction. Number 5, forgiving or letting go. So a lot of anger, a lot of political angst in various countries. In England, it was bad for a while. In Italy, in Spain, in Canada, in the United States, it has reached a fever pitch. And this anger has really complicated things. When hurt, there is a tendency to seek revenge or avoid the person that has hurt you. Now, forgiving doesn't mean you have to restore a relationship or excuse or condone an action, because forgiving is something you do for yourself and not for the person or people who have wronged you. So try to forgive during this time, or at least to let go if you can't forgive, because these feelings can really harm you psychologically. The benefits of forgiveness are less anxiety, less depression, less hostility, less alcohol abuse, less smoking cigarettes. And there's positive emotion will increase. You'll be happier, you'll have more compassion, and you'll have more positive relationship with your partner. So try and be more forgiving during this COVID-19 pandemic. Number 6, avoid irrational thinking. As Marcus Aurelius said, he's quoted as saying, the happiness of your life depends on the quality of your thoughts. So the way we think determines how we feel. And this is the basis of a psychotherapy technique called cognitive therapy, where our thoughts predict our feelings and our behaviors. So if we're constantly thinking negative thoughts, bad thoughts, we're going to feel depressed, we're going to feel nervous. Unreasonable thinking or self-talk will be things like maximizing the negative. It's all bad, there's nothing good, and discounting the positive. The masks won't work. Washing the hands won't help. Social distancing is a waste of time. If you discount positives and maximize negatives, this is going to leave you feeling depressed and anxious. Another thing that we do with our thinking is we estimate the likelihood of the worst outcome. That's also damaging. Another thing we do that makes us upset and unhappy and anxious is we tend to catastrophize. We imagine that the worst is going to happen. So during this COVID-19 pandemic, we must follow good, sensible news. Don't let it become infected by political rhetoric. And the more we know has been shown scientifically to help us feel better. If you want to learn the basics of CBT, just check in on cbtbooklet.com. This is a useful 12-page overview that when you read it, you'll know all the basics really of CBT and how it can affect and improve your mood. Number 7, look after your body. It's important during the COVID-19, especially during lockdown, that you maintain a schedule. Go to sleep on time. Don't spend all night looking at those negative newscasts. Shower in the morning, shave if you're a guy. You know, keep your routine up. Don't just let yourself go. Dress. It'll make you feel better. Even when we have patients on our ward, when they come in, when they've been very ill, we try and get them into a schedule as soon as possible because it's important. Exercise is important. Eating healthy is important. Avoiding substance abuse. It's interesting that during the lockdown, LCBOs, marijuana shops were seen as essential services. However, it's important that everything be done in moderation, that you don't use alcohol and cannabis excessively. It won't help. And of course, using personal protection, very important. It was interesting that when we looked at the studies, the psychological symptoms were reduced when people did wear masks, when they did attend to good hygiene, and when they did attain good health information. All these techniques were helpful in reducing the mental health effects of COVID and improving happiness. When it comes to exercise, exercise will protect against chronic disease, will make you live longer, it'll reduce depression, reduce anxiety, it'll improve your self-esteem. It's interesting, when it came to treating depressed patients with antidepressants or exercise, the exercise was just as effective as antidepressants in relieving the depression seen in these patients. So don't underestimate exercise. And the exercise that was demanded of these elderly patients wasn't severe. It was a little bit of aerobic exercise daily. So exercise is important. Other good news is that when you are exercising, you don't have to exercise excessively. This study looked at the amount of exercise hours per week that helped reduce depression. And as you can see, 1 hour of exercise was just as good as 4 hours or more. So a little exercise every day, very helpful in reducing the stress and unhappiness associated with COVID-19. Last but not least, it's important that if you feel that the unhappiness is not just unhappiness, it's a more severe entity, such as clinical depression or an anxiety disorder or an abuse of substances, it's important that you reach out to a professional. Usually it'll be your family doctor or general practitioner to get help. If you want a quick overview of some of the symptoms of the more serious illnesses that are occurring during this time, please check out drberber.com, where I've listed in an easy to understand manner the symptoms of these more serious illnesses. So, just wrapping up, don't forget the COVID-19 pandemic is not going away anytime soon. It seems the numbers are coming down, but we are worried about a second wave, which may or may not come in the fall. So please remember the 8 steps to reducing the mental impact of COVID-19 during this time, and hopefully to increasing your happiness. They are: nurture relationships, express gratitude and savor the moment, practice kindness both to yourself and others, relax with some of the techniques and avoid news addiction. Just stick to the good news, not too much every day, the sensible news, the rational news, not the hysterical political news. Learn to forgive and let go. Avoid irrational, unreasonable thoughts when it comes to COVID-19. Look after your body, get some exercise, sleep, take a schedule, get dressed, shave. And lastly but not least, do be aware that when unhappiness has become something more serious, like depression, where you're feeling hopeless, you've lost interest, you can't concentrate, you're thinking, life isn't worth living, you're too anxious, it's not worth it. Do reach out. There is help out there for you. It's important. Don't suffer in silence. So I want to thank you. I hope this has been helpful. And this is Dr. Mark Berber from Markham Silva Hospital, signing off. Thank you.